Hey guys, my name is Ashni and I'm a medical student here in the United States. In today's video, I want to talk to you about osteoporosis, what it is, what are the risk factors for it, and what are some changes that you can do to decrease your risk. So without further ado, let's get started. Please note that I'm not a doctor and I am not giving medical advice in this video, but I do hope it helps inform you of what is osteoporosis. Osteoporosis is a disorder of the bones in your body, and in osteoporosis, the structure of the bones deteriorates and the bone mass decreases, and this all leads to a decrease in bone quality and an increased risk of fractures. And fractures, especially in patients who are older, can have a lot of morbidity and increase your mortality even. For example, a very elderly woman who sustains a hip fracture might not even be able to walk alone again. So who is at risk for osteoporosis? Well, osteoporosis is largely determined by your genes. Your genes play a large role in the development of your bone mineral density and so also relate to developing osteoporosis. Other risk factors for osteoporosis that a patient can control is smoking, excessive alcohol intake, poor nutrition, and a sedentary lifestyle. Sex also does play a role in osteoporosis, as women are 5 times more likely to develop osteoporosis than men. However, it does affect both men and women. Last but not least, certain ethnicities have a higher risk of osteoporosis in the population, even at the same bone mineral density. For example, Caucasian women have the highest risk of getting a hip fracture. To understand the physiology of bone, we have to know that bone is actually a living tissue. In your bone, there are cells called osteoblasts, which lay down new bone, and cells called osteoclasts, which reabsorb the bone and break it down. And there's always this balance of remodeling and resorption that occurs in your bone. When people are younger, the balance of bone building is higher than that of bone. But as you age, that balance shifts and your bone mineral density decreases as a result of aging. As you age, that balance shifts towards resorption of bone, and you tend to resorb more bone than you build, and this leads to a loss of bone mineral density, and that is why older people are more at risk of osteoporosis. In a person's lifetime, most of the bone growth occurs during childhood and adolescence, and this is all influenced by that person's genes, their lifestyle, and other environmental factors. There have been studies conducted on when a person reaches their peak bone mass, and some studies show that it's between 19 years old in women and around 20 years old in men. Other studies have shown between the ages of 11 and 13-year-olds. Regardless of when that occurs, after that age, people tend to have lower and lower bone mineral density. Puberty and sex hormones do play a role in your bone health. During puberty, hormones increase bone mineralization. In women, with the decline of estrogen that occurs during menopause, there is a rapid loss of bone mineralization. It's important to remember that estrogen does play a role in bone health, but osteoporosis is caused by multiple different factors. Okay, so next I want to talk about how we can possibly maintain our bone health and what can we do to prevent the risk of osteoporosis. One of the major parts of this is physical exercise, and the other part is nutrition. So any kind of weight-bearing exercise. Weight-bearing exercise means that your feet and your legs are supporting you as you're moving. So walking is a form of weight-bearing exercise, so is jogging, so is weightlifting. Since bone is a living tissue, by exercising your bones and putting them through healthy amounts of stress, and just even the effect of gravity puts your bones through healthy amounts of stress when you're doing these weight-bearing exercises. So just as muscles would grow after exercise, bones will increase their strength after this kind of exercise. The next important thing to consider is your nutrition. You want to make sure that you're getting as much calcium and vitamin D as you need. And the best way to get calcium is through a healthy and balanced diet. A 2011 study by the Institute of Medicine recommends that patients, depending on their age, get 1,000 milligrams of calcium a day to 1,300 milligrams of calcium a day. But this is taking into account the calcium that you get through food as well. The recommended amount of vitamin D by the Institute of Medicine in 2011 was 600 international units per day, and after the age of 70, it's 800 international units of vitamin D per day. The next thing I want to talk about is how osteoporosis is diagnosed. It's recommended that people are screened for osteoporosis around the age of 65 with something called a DEXA scan, which is similar to an X-ray. This test is mainly looking at your spine and your hip. After this measurement, you will get a T-score, which shows in comparison to a 30-year-old, how does your bone density compare, and it looks at the standard deviations on a population level, and depending on the score that you get through this test, that will determine if you have osteoporosis or not. If someone is diagnosed with osteoporosis, there's a variety of lifestyle modifications and medications that can be prescribed to help with managing this condition. Okay, so I hope that helped you learn a little bit about osteoporosis and a few ways that you can prevent it, and I hope this video was helpful.